The factors relating to poverty are not going to be those that are killing doctors, and yet we're seeing they're disproportionately affected. Something like the first 12, maybe more, were BAME. The statistics are telling us that ethnic minorities in the UK are more at risk. The first that came out were that around a third of patients in intensive care units are BAME, Black, Asian and minority ethnic. And this compares to them being about 14% of the population of England and Wales. And it's really been notable amongst health workers as well.
NHS medics are dying, and Dr Alpha Sadhu is one.
Amjad El-Harani was an ear, nose and throat specialist.
Edmund Adedeji died on Wednesday the 8th of April.
Mary Agyapong, said to be a highly valued and loved nurse.
Organ transplant surgeon Dr Adel Altaya, volunteering for NHS work in the Midlands.
Lynette Cruz, Melugene Ballesteros, Cheryl Williams, Oscar King Jr.
Faiz Ayash, a Syrian British medical doctor.
And whilst there are more BAME people in the NHS compared to the wider population, it's still only 20% of staff, and I think it's 44% of medical staff, so it's still really disproportionate. The latest figures I've seen are for all the healthcare workers who have died, something like 63% are BAME. We don't know for certain what is the reason, but there are a number of possible explanations, and they include existing health inequalities. For example, BAME people are more likely to suffer from heart disease, kidney disease, diabetes, and hypertension. These are all illnesses which increase your risk of dying from COVID if you get it. There are several reasons why BAME people are overrepresented in terms of these diseases. One is poverty. That affects your susceptibility to certain diseases, and BAME people tend to be overrepresented in people on lower incomes in the UK. There are also genetic factors. So, for example, South Asian people tend to store more fat around their abdomen and other parts of the body around vital organs, and that makes them more susceptible to these diseases as well. Another factor that some people have cited as a possible explanation is vitamin D. According to some studies, vitamin D helps boost the immune system. The problem is that BAME people absorb less vitamin D through the sun than white people. But it's important to point out that there has been no proof that vitamin D protects against COVID-19. As well as being overrepresented amongst healthcare staff, they may also be overrepresented amongst other key workers. BAME people tend to be in lower paid work with more uncertain contractual arrangements. For example, many couriers are BAME, and couriers are one of the professions that are still working throughout COVID. Similarly, bus drivers, and I think 25% of TfL staff are from a BAME background. Other social factors are that BAME people are more likely to live in overcrowded accommodation. For example, 30% of British Bangladeshis live in overcrowded housing. Now, this compares to just 2% of the white British population. And with COVID, the more people you're exposed to, the more your chances of contracting the illness. When we see the amount of doctors that are dying who are from a BAME background, issues of poverty and education are not really relevant to them, which suggests other factors might be at work. One of the key things in the UK that hasn't been collected is the BAME data for actual cases. We just don't know how many of the people who have tested positive for coronavirus are BAME. It's important we understand why minorities are more at risk, because there may be very real measures that can be taken to lessen their risk. And until we know just what's causing it, we just don't know what those measures can be.